A new program has been launched that's designed to help train community health workers. The online program is paired with internship and apprenticeship opportunities. And here now with the details is Mindy McEntee. She's from ASU's College of Health Solutions. And we should mention the College of Health Solutions, you guys are behind this program, correct?
Yes, absolutely.
Talk to us more about it.
So this program was the result of a $3 million federal grant to increase the community health worker workforce here in the state of Arizona. And a lot of folks have talked or are aware of the shortage of health workers, generally speaking, across the state. But this is an extra element of being able to address health concerns in specifically medically underserved areas of the state.
Define a community health worker.
Great question. So community health worker is used as an umbrella term, and it encompasses a lot of different titles. So community health representatives, they're also known as, or promotoras. Also, sometimes they're called case managers or outreach specialists. It's basically anybody who performs this function of being a liaison, working with folks who are in the community and helping them to get connected and established with some of the services that they need.
And often these folks are from the community, I would imagine.
Yes, absolutely. And that's one of the great benefits of it is you've got somebody who's already familiar, living in the community, has the trust and the understanding of what it is that those residents need.
And the idea is to, improve access to just better health services. True?
Yes, exactly. So one of the things that we know is that social determinants of health, or just the conditions where people live and the social environment, the economic situation in which people live, is a better predictor of health outcomes than other things that we might have thought about. So things like health behaviors or even access to care. So being able to help get folks to address those structural issues and to get them connected with care is a really vital first piece. And community health workers, since they come from the community and they know these people, they have the best way of being able to approach them and helping them to get engaged.
And this is an online program. Are you training people that already live in the community? Are there people that sign up for the program that would go to how does this work?
So the way that it works is it's an online curriculum, so it lasts 2 academic semesters, so fall, spring, and it's 10 to 15 hours a week, and it's an asynchronous course, which means people can do it on their own time. We just have established deadlines throughout the course to help people stay on pace. And then at the end of those 2 semesters, we help pair people up with community partners who are local within their community. And then they will be able to get more specialized hands-on training, actually doing CHW work, and then hopefully with that being able to lead to full-time employment.
When you say community partners, are these folks that are in health services, the industry?
Some are health service industry, some are just community-based organizations. So we have a combination. We are also open to continuing to work with new community partners. So anyone that has been able to utilize community health workers either for health education or helping to connect folks with additional resources that they might need. So example, signing up for SNAP benefits. Those are the kinds of community partners that we're interested in working with.
Informational stuff there, very important. It sounds like a godsend for underserved communities. Sounds like it would really work well with tribal nations. Is that what you're seeing?
Yes, absolutely. So Phoenix Indian Health Service is one of our partners. And that is one of we have noticed with the 60 or so folks that we have signed up already, that there is a large representation from that population. And so that's one of the great things that we're looking forward to being able to continue to work with.
And again, that community connection, the culture, the language, the social dynamics, that really does make a difference, doesn't it?
It does. You know, one of the things about community health workers is that despite not having prestigious education or a PhD or an MD title, they're oftentimes more effective at being able to, understand boots on the ground. What is it? What is the living situation? What is the day-to-day like for these folks? And by doing that, they also have some of the abilities of being able to spend more time with them. And providing some of that extra support that goes a long way in helping to get those folks connected with services and also just help build better quality of life.
You mentioned background and qualifications and such. I've read that the graduates are eligible for voluntary certification for the State Department of Health. Talk to us about that.
Yes, so back in November of 2022, the state of Arizona introduced voluntary certification for community health workers. So as implied in the name, this is voluntary. but it's an effort to help promote the legitimacy and really recognize the value of the folks who are in this position. And so what it is basically a way that the state has recognized or is able to recognize folks who have completed approved training programs. And so it's an effort to standardize the background and make sure that these folks are really prepared to engage in the activities they need to do to be able to help these people.
And we should mention there is a stipend involved for full-time participants.
It is. So the grant, one of the nice things about it is that most of the money is going directly to our learners. So folks who are accepted over the course of this grant, which runs through 2025, will be eligible, up to 200 learners will be eligible for a $7,500 stipend. And that $7,500 stipend is contingent on their continued participation in the program. And it's designed to help make this even more accessible to folks who may have an interest in healthcare or be interested in helping their community, but may have had some other barriers that otherwise have kept them from being able to do so.
And we should mention the July 31st deadline for applicants this go around?
Yes, so the July 31st deadline is the application deadline for the cohort starting in August. That being said, we do have other cohorts. There's a total of 4 cohorts that are going to be running during this grant period. And so if folks miss the July 31st deadline, continue to apply because our next cohort will begin in January.
Very good. Mindy McEntee, the ASU College of Health Solutions. Great program. Good to have you here. Thanks for joining us.
Thank you. Appreciate it.